Dr. Meyer, we can see you.
Okay, I'm here.
There you are. There you are.
Me too, right?
Perfect. Just 1 second. We're letting some people join the presentation, just sharing a little video with everybody.
Okay. I have my phone just sitting up there the thing. You can just hand it to me every now and then.
Let's see here. 1 second. I'm going to play this one more time.
Thank you. Thanks. You tell me, Taylor, when I have to shut up, but
You're totally fine.
you know, I tell you, I'm just picking herself up. So tell her, they call them, I said, give it, whatever. And they just rest, they just so long to do. I said, if you
This
don't
video is supposed to have some really fun, dancey music, but it's not playing, so we're just watching in silence.
I swear I will too, because she asked for it specifically, and she's never done anything. She's never, she doesn't even drink. That's a problem. That's what they're trying to do. She'd have a glass of wine. I'm like, I'm not drinking.
There we go. Okay, perfect.
Let me ask
like I said before, my name is Taylor Butler, and I'm the marketing coordinator for Sanova Dermatology. And I'm super excited to be here with the lovely and talented Dr. Sharon Meyer, who practices at our Uptown location of Sanova Dermatology. And just a few little tidbits about her beyond I could not express enough how talented she is. But the information speaks for itself. She is a cosmetic expert, but she does practice 50-50 in both cosmetic and medical. She actually dropped in from a surgery just a second ago, so we're excited that she's here. And she's been in practice for over 30 years, so she knows her stuff. She is super excited to be here, and I just want to give you a warm welcome, Dr. Meyer. And then I've also got Warren Ebos from Revance, he's actually our account manager, and he works very closely with the RHA Collection, which we're here to chat about today. So I'm super excited to have both of you. Thank you so much for being here.
Thanks, Taylor.
For sure, for sure. So since you're here, before we start talking about this new product, I wanted to chat with you really a bit about why Sanova. So Sanova itself actually stands for, in Latin, health and innovation, which is something that we at Sanova Dermatology really pride ourselves on. We really love the ability to stay on the forefront of all medical and cosmetic opportunities that come into the dermatology sphere. And that includes things like the RHA Collection, which is something that's new. It's a lot of different things. We have other things coming up, an injectable for cellulite. And then also the medical. I mean, we offer Mohs surgery in our clinics. We offer a wide variety of things, and we're always looking for the newest and the greatest and the best, not only in services, but our providers, which, as you can see, the talented Dr. Meyer is here with us. So that definitely shows that we're trying to stay with the greatest. So that's a little bit about Sanova. So we want to move a little bit closer to the RHA Collection and actually talk to Dr. Meyer a little bit about the aging face. So I'm going to pass the baton over to Dr. Meyer.
All right, Taylor, this is where I start.
Yes, go ahead. Green light.
Okay. Well, my patients that are listening, as you know, I'll be brief and to the point, but the definition of beauty, say a person who's 16, 22 or something, it's like an inverted triangle. You know, they have some fullness in here. There you go. Have some fullness in here, narrow here. And I'm not going to read all those things on the left-hand side, but as we age, unfortunately, the triangle kind of flips. And then we get heavy down here. We lose some fat pads here, and everything just kind of falls. And then we see these fat pads, and we lose some volume. We get these gels. We have a pre-gel sulcus, a post-gel sulcus, and we get, anyway, so you know. And you're genetically dealt a certain hand. You know, those girls that when they're 16, 20, they have a nice round face, everything looks so good. I've told some people that have a nice red triangle, they're thin down here, I'm saying they probably age better if they don't start out that way, you know, because anyway, that's not what we're here. So, what else? So I think I covered all that. So, oh, and this is about these yellow areas are where some of our fat pads are. And we need to introduce volume into some of these areas, which we've lost some fat, basically. And there's many different products. Warren, you know, he'll jump in and say more about his product. But like Taylor said, I've been doing this for, I can't believe how old I am now. I've been doing this since 1991. Now it's 2001, you know, it's 21, so it is 30 years. And there have been fillers out there ever since I started working. And so I've been dealing with fillers for 30 years. And things do come and go. I mean, the first ones were Zyderm, Zyplast, you know, all these, and we had to skin test people to see if they were allergic. And it was bovine collagen. And so we had to, it was bovine collagen. So now it's all about hyaluronic acid, which is a natural substance. It's what my orthopedic husband injects in people's knees to make the, you know, joints flow smoother. But there's other products too. Yeah, I'm gonna get to that, the toxin thing. So leave that slide up there. There's other products too, you know, there's Sculptra, which is polylactic acid, there's Radias, which is calcium hydroxide, so calcium hydroxyapatite. So it's not just a hyaluronic acid, but hyaluronic acids are the bulk of the market, okay? And ones come and go. Ones come out and we're not that crazy about it and we quit using it, and new ones come out. So we're excited about Warren's, their product. Okay, so go back to the neurotoxin slide, like past this fat pad slide. Yeah, okay, so this we put in here because patients come in and they go, they don't like, you know, I would say between 45 and 55 is a hard time for a woman. That's when our aging really starts to show, you know, when things start to do that inverted triangle. And people come in and they go, don't I need a little Botox down here, you know? And really, that's where we get fillers. Fillers we don't really do fillers here, okay? So the 11s and the forehead lines, that's where we use toxins, whether it's Botox, Dysport, Xeomin, or Jeuveau. Those are all toxins. When I say Botox, it's really like saying Kleenex when I mean to say tissue paper. It's just easier, okay? So anyway, so most of my patients come in, they get a combination of things. They get toxin and filler. Some people just do one or the other, but a lot of people come in, they get both. All right, I hope I covered that okay.
100%. And I did want to reiterate something that Dr. Meyer just said, or kind of envelop everything that she just said. Something that's super important is to come in and get a consultation, because we, in situations, may hear from other people certain things or certain products or what they do and where they do it and all that sort of stuff. But something that's super important is making sure that you visit your dermatologist and find out the best treatment plan for what your aesthetic goals are. And Dr. Meyer, I think, will agree with this, that's super important in the process. You may come in and say, I want to get this. Well, Dr. Meyer may say, well, I've seen better results with this, or I think that you should treat here because that will affect this. Just a super large proponent of making sure that you're getting a consultation and treating your specific needs, not just the general needs.
Yes, and I do not want you as a patient to stress out when you read about, oh my God, which one's right for me? Which one's right for me? That's not your job. Our job is to figure out what's right for you. And I mean, it does help if you call and say, I need a filler appointment. You don't want to just get a regular appointment if you plan on getting filler, because it does take longer. And let me just say this, that anytime we put needles somewhere, you get bruised. So you want to avoid aspirin and Advil for 2 weeks prior possible. You know, there's other things, like if you get a history, if you have fever blisters around your mouth, you want to take a pill before we inject and after to prevent something from coming out. But we have them here if we need them. So it wouldn't help if you say a filler appointment, but it's not your job to know which filler. I will tell you this, I can't think of a filler on the market that I don't do. And in fact, other dermatologists who are good injectors in hyaluronic acids, they may not do Sculptra. And so they send those patients to me, because not every dermatologist does everything. And so I would hope the majority of people watching this are my patients, but if you're not, if you have another dermatologist and a dermatologist may talk to you about just what they feel comfortable with, what they're used to doing. But there's one that I don't even know there's on the market anymore, Articol. It was lasted 5 years, which a lot of us felt like was too long. If something doesn't go well, you're stuck with it for 5 years. So I don't even know if that one's still on the market, but that's the only one in recent memory that I just said, no, I don't want anything to do with that one. Okay, so now I'm rambling. What are we going to say here? So why, and I talk fast, sorry. Why hyaluronic acid fillers? Well, first of all, for virgins, filler virgins, as I call them, people that are nervous, they've never done it before, it's reversible, okay? It's one of the few fillers that really are reversible. We use it in the lips, we use it in all kinds of places. We even can plump up your earlobes. I mean, there's not a place we can't put it. There's many different ones of different thickness, actually. You don't need to know all this as a patient, but there's different things that the doctors kind of learn about G prime. And then something else about the flexibility of it, how long does it last? How easy is it to reverse, which thank God that doesn't need to be done hardly ever. So what one thing that people don't realize, they come in, they go, these little lines here bother me, but usually they need volume overall. Okay, so I think that's it about this side, huh? Okay, anything else?
Perfect. And so what I'm actually going to do now is toss it over to Warren, who's we're gonna kind of start initiating the discussion about RHA and how it was brought to the market.
Can I ask one thing? One, I didn't verify this with you, but not a long time ago, months ago, when we first started talking about this, I think you told me this collection has been out for 15 years in Europe, 15 million people injected. Is that true?
It's close, Dr. Meyer. So it's been in Europe for 5 years. And that's when it came to Europe in 2015. And then now we have approval in the United States. So got a lot of really good experience. And that's a great point, that the product is new to the US, but it's not new to the world market. So good point.
And do you know about how many people in Europe have been injected? I don't know why.
I don't know that number, but there sure has been multiple millions. So it's been used for over 5 years. And actually this product has kind of gained a number 3 spot in Europe as a filler. And as you know, there are a lot more products over there. The approval process is a bit different. So yeah, lots of experience with this product.
Well, last thing, and then I'll turn it over to you. I want patients to be comfortable with that information, because I think it's great that Europeans test things for us. I remember when Botox first came out, I was a little nervous myself. I told my staff, I said, I'm going to let the Californians and the New Yorkers figure it out. Come do it for 2 years, and then I'll jump on the bandwagon. And I didn't touch it for 2 years. And so the fact that this has been tested in Europe for 5 years, it's in my lips right now. It's in 2 of my staff members wanted bigger lips. It's in them, so I'm not afraid of it. And so it's not like it just got tried yesterday. Okay, now I'll be quiet.
Exactly. No, that's a great point, Dr. Meyer. It's a good segue, and I appreciate that. And first off, let me just say a big thank you for this opportunity just to give a brief overview of the RHA collection. We're very grateful for that. And to Taylor's point and to your point, Dr. Meyer, it truly is important for the patients to just know some basic information, and then obviously go to see a physician for an assessment. I mean, that's what this is all about. This is not about asking for a certain product. This is really about just educating what the new tools on the market are. And we are super excited to bring the RHA collection to the United States. It really is the first new technology. There's been a lot of fillers, as you alluded to. There's been a lot of technology over the years, but this is the first new technology in over a decade to actually be changed in the filler market. So we're really excited about that. RHA Collection stands for Resilient Hyaluronic Acid. So it's kind of interesting that our name is, simply RHA Collection, but a lot of folks ask that question, hey, what is that all about? So, and it's actually 3 different products. We won't really go into that, but it's 3 different levels of product that we'll talk about today. And just real quick on background too. So one of the leading ladies on this product is Madame Valerie Taupin. And why this, I think this is important, is if anyone's heard of Juvederm, which is a great product, they've been very successful over the years. Madame Taupin was one of the co-creators of Juvederm. So she was one of the folks behind that very successful hyaluronic acid filler over the past 20 years. And basically she went back to the drawing board and said, hey, we're going to start Teoxane, and we're going to try to develop a hyaluronic acid filler that's more like the natural HA in the skin. Well, that's really easy to say. It sounds like a marketing ploy, but it's very difficult to do. And over the past 15 years, that's what's been going on with this development. And hence we have the RHA collection that's been approved in Europe for the past 5 years. One of the biggest things we think from polling and talking to obviously lots and lots of patients over the years is that one of the things that may scare patients away or make people hesitant about a filler in general is an unnatural look. And while that sounds really obvious, it's something that you see things in magazines and you see things on TV and you say, boy, I may not know exactly what I want, but I know what I don't want. And I think that's one of the things that Madame Topin really focused on with this product, and really trying to make this product more like the natural HA in the skin. So the manufacturing process is different and much different than anything else that's been out on the market. And that's what makes the technology more improved and better. And also it's indicated specifically for dynamic wrinkles and folds. And Dr. Meyer can talk a little bit more about this, but over the years, addressing static things like lines and wrinkles, that's something that's been addressed very well. I mean, that's something that can be addressed by a multitude of different products. And this product, I think, takes it to another level and gives the physician another tool in the toolbox, another few tools in the toolbox to be able to address those more dynamic wrinkles and folds as you express your face that you would not see that you had a filler. So I think that's important in terms of looking natural and being simply more like yourself and not looking overdone.
Awesome. Thank you so much for sharing that. We're actually going to talk a little bit more, since we've kind of learned a little bit about the products and a little bit about how they came to the market and how they've been tested and used in Europe and all of that. We're actually going to talk a little bit more now with Dr. Meyer about the different types of products that they offer and potential areas that you might use any of these products. Like I said, this is something that you would definitely want to reach out to your cosmetic provider to ask information, because it's up to their discretion as to where they're used. But we wanted to kind of talk a little bit about where they might be used.
Well, 2 is, it's right here. 2 is mostly in here. Fine lines, okay, and also that's what I have on my lips, to enlarge my lips a little bit. And as y'all know, I am so conservative. You would not look at my lips and go, oh, she's had her lips done. And I've never had anybody in my whole 30 years come back and say, oh, you made my lips too big, please erase them. Okay, so if anything, you may want them bigger, but I like to go on the left side, Okay, go ahead and go to 2, if you will. 3, yeah. So it goes 2, 3, 4. Let's go. I'm gonna jump all the way to 4. 4 is, and I'll come back to 3. 4 is if you really want to build up this area, like if somebody's, you're not gonna pull if somebody has some deep nasolabial. These is called the nasolabial folds. These are the myolabial folds of the marionette line. Just think of a puppet, So this is good for there. But a 30-year-old doesn't need this really, right? And maybe a 30-year-old if she wanted to build this up. And then 3 is kind of the workhorse a little bit. You can kind of a little bit in between. What I try to do for patients to save money is I try to look at what I think they need, what they think they need, and what's the least number of tubes that we can use to get that. And so I might pick something that I could say put a little bit here and here, but you're kind of wasting if you're putting 2 up here. My nurses, 2 of my assistants, actually, one was a medical assistant, but the point is they really wanted bigger lips, and so they got the 3 in their lips, and they're thrilled with it. But I didn't do that. I wanted to start a little slower. What else? Let's see. He's going to show some before and after pictures later, which are actually from the company. They're not my pictures. I really don't have many pictures of patients, because not many patients that I treat want everybody to know what they look like before and after. And usually I have some other before and after of other things like Kybella and whatever. And I usually give them something to let me use their marketing picture. So if a patient is out there that will allow us to use their marketing picture, I am sure that Warren will give them free product. Right, Warren? So that's why pictures are.
We can work on that for sure. We have a special coming up too at the end, so stay tuned.
Yeah, I'm not saying we need tons, but that's why I don't have a lot of pictures of mine.
And just to hint at that, I do know that we are going to be offering some raffle prizes. So I'll tell you a little bit about that in just a minute, just since we're talking about that product. But anyways, sorry.
So getting back to the before and afters, I kind of looked at how many tubes they got though. And a lot of them got anywhere from 2 to almost 4 tubes. So that's something we can discuss when I see you. Like if you say, how many tubes do you think I need? Like you cannot get your lips done and build this up and this for 1 tube. It's just impossible, okay? So if the tubes are say $7.50 a piece, you gotta You got to know all that before you come in. So
Definitely. And that's another reason as to why those consults are super important. So you can have that conversation and figure out what's right for your budget, what's right for your goals, how we can fit the products that we offer into that. And that's a great thing to mention. So like Dr. Meyer said, we're going to show the companies before and afters. We have a cute little video to show right now that kind of gives a wide range of patients, including men and women of different ages. And I think it's a really great way to kind of see what Warren stated earlier a bit about kind of the appearance and how you can be treated and not look overdone, which is something that we are really mindful of.
parties at your kids, what is that?
Perfect. And like I said before, sorry, the audio on the videos isn't working, so it's a little funny for us to sit in silence and watch the videos. But what's really great about those is that I feel like it's a very subtle difference, but you can tell something has changed and they look a bit more refreshed. You're just not 100% sure. So I'm going to let Dr. Meyer talk really quickly about these next two photos and just kind of share with you what she sees.
What, this lady here, you saying? Well, I think what he said is really true. These are kind of believable results. She still looks herself. You can tell under her eyes look better. You can tell her marionette lines look better. If you look at her nasolabial folds, they're better, but you don't want to totally efface that. You have to have some, otherwise, I mean, I tell you, if you ever look at a monkey, it just totally changes your shape of your face. So you don't want to totally get rid of it. You want everything just to be a little softened. Yeah, and same with this lady. You can tell by doing her mid face is what they call it. She looks a lot better. And the some at the lower down. I don't think she's had her lips done, but you can tell down here in her myelolabials. Back in the day, like I'm talking 25 years ago, you know, people just come and say, I want this done, I want this done. But now every aesthetic article you read, it's this area here that's very important. And once this area is done, it actually helps us by lifting things up. So it doesn't do any good to do this and not make this more full. All right, that's about all I have to say about that.
Fantastic. Well, I think that, like we said before, I think the results speak for themselves, and they're something that look very realistic, and something that we see that, like, it's one of those things where you're not going to come out and look like a completely different human. You're going to look like you, just like you went on a really great vacation. And like I said, Dr. Meyer is one of the great and very expertly trained cosmetic providers at our locations throughout Louisiana that can help you decipher what the best option for you is. So I can see people are starting to put their names in the box. So I'm going to skip to the raffle really quick. So Warren is very, very, very kind and is allowing us to raffle off 2 syringes of RHA product, which is super exciting. So I will be, if you put your name in the box, I will be pulling these out and we will be drawing those individually. So 2 different people will win 1 syringe, which is super exciting. It doesn't happen too often. It's quite a bit of gift. So thank you, Warren, so much. And then I want to talk a bit about the offer really fast. So this is an exclusive product. It's at select practices in the region. And so we were lucky to be chosen as one of the select offices that offers it. So right now we are one of a few very lucky people to have this product, and that kind of makes it a little bit more exclusive. And we are going to offer you an exclusive offer for that. So basically what's going to happen is if you purchase 1 syringe of RHA, you'll save $50 off that syringe. If you purchase 2 syringes, you will save $75 off of each. And if you purchase 3 or more, which is something you should discuss with your provider, you will save $100 off of each, which is a fantastic deal. And it's one of the best deals that we offer on any of our fillers. And so this is a really great opportunity for you to try something new if you and your provider decide that's the best option for you. Let me see. Someone is extremely interested. I'm seeing all the people pop up in the chat. I did ask a question. Is the consultation free? So
I'm sorry, can I answer that? Do you mind?
100%.
I would love to see all the questions and just tell you if I could answer, you know, that, or consultations. If somebody, the way I've always done this, if somebody's in for a body check, they're getting some medical stuff done, and they go, what about this real quick? You know, and I just kind of summarize it real quick. I don't charge a extra for that, okay? However, now there is a charge if they bring in all their products that they're using. I got to go for 10 or 15 products. And so, you know, they want to talk about filler, they want to talk about this, but they just go, you know, how many tubes do you think I need? Or how much is the average price for toxin, whatever. That's a freebie, okay? And sometimes if I'm not behind, I'll do it, at least the toxin right then, but usually it's a rebook. Okay, now if somebody takes up one of my patient time slots for consultation, they're not coming in for anything else, it's nothing I'm billing insurance for, then we have to charge something because we lost that time slot where that could have been treated acne or a rash. Is it still $75, Christine? Yeah, it's $100 to be applied. It's $100, but if you book your filler, we that's applied, you know, so you don't lose really. But if you just kind of want to talk and go, no thanks, I decide not to do it, then we keep the $100 for our time.
Perfect. That's a great example. So typically what will happen is, and it may vary based on the location, so I would definitely suggest you call your specific location, but typically how it works is you will pay a $100 cosmetic deposit if you're coming in solely for an evaluation on cosmetics. And then if you book for an appointment, whether it's treated at the time if possible or at a later appointment, that $100 will be applied towards your purchase, which is a really great deal. So basically just kind of securing that. And on that note, we talked about the discount that we're offering today. In order to lock in the discount for this event, we are requesting that you pay a $100 deposit, which will apply just like we talked about. It'll basically hold your spot and will also secure the discount. You can do that via shopmdskincare.com, which is a website where you will be able to purchase it. I'll put the link down below. And it also was in the email that was sent out to you before this and will also go out afterwards. Another option you can do is call your office, your preferred location, and they can help you to get scheduled, and you'll just pay that $100 deposit. And just make sure to let them know that you joined us for the event and that you're interested in RHA specifically. But like I said, it is a conversation to have with your provider about what product is best for you. And then also as a courtesy, we will be offering your patients we will be offering you patients a follow-up call, regardless of whether or not you contact us, just to make sure you don't have any questions or make sure there's anything we can do to help you get scheduled. And I'm seeing here, yes, thank you, Warren, for the opportunity. Linda Dr. Meyer has a great question that I think will be very easy to answer. Can you mix fillers?
Yeah, can you mix, can you get something here, something here? Absolutely, do that all the time, yeah.
Yeah, there's a
And can
large...
I say, the questions that went in or the comments that went in, everybody sees everything, so shout out to Rita, thank you, Rita. You know?
Yes, Rita, I just wanted to say that I had RHA fillers in my lips from Dr. Meyer, and she's super pleased. They look beautiful, which is amazing to hear. We love hearing that. Thank you so much for sharing. Let me see here if I have any additional questions. Okay, this is a great question for you, Dr. Meyer. In general, how long do fillers last?
Oh, that's a very important question. Okay, this is my new answer, what I'm saying to people, and I tell you why. I say anywhere from 9 to 15 months, although there's some like Sculptra that can last 2 years, and radiance maybe last longer, but hyaluronic acid fillers, 9 to 15 months, depending on your body's metabolism. That's one thing. People are just different. You know, some people that are exercise all the time, then there's those people that seem to eat everything and they don't gain weight. You know, they just can have a fast metabolism. Some of these studies, like that say it lasts a year, they last a year. If you read the fine print, it says patients were offered a touch-up or retreatment at 9 months. Well, that's not fair to me. I mean, I think you ought to just inject them, look at them in a year, look at them in 15 months, look at them at 9 months, whatever. But these touch-ups, I just think that throws the study off. And so a lot of studies, unfortunately, including the RHA study, which they can say 15 months, I think some of them were offered a touch-up. So now that, you know, the jury's out. Like, does this last longer than, you know, I know somebody asked about Juvederm wrestling. Those are some of the names that y'all been hearing of forever. We don't know for sure if it lasts longer or not, because I've only been doing it. I mean, I've been doing this for what, 6 months, maybe one, I don't know. I just know, I tell you what I like about it though. I like the way it feels with the push, the way it feels when it goes in. I like the way it doesn't feel too firm. Every doctor I've talked to feels the same way. We really like the way it feels. Patients like it. But in terms of longevity, I can't tell you. It's probably gonna be comparable. I can't tell you whether it lasts longer. But and I tell people too, it's not like here and at 12 months you get nothing, right? It just kind of starts to dwindle a little bit. And so you may want, it depends on how much you tolerate this dwindle. You may want a touch up. If you come get your toxin every 5 or 6 months, you may want to touch up then. You may want to wait and do it once a year and get your toxin every, 2.5 times a year. Anyway, long answer. Hope it helped.
Phenomenal answer. Loved that. No, it definitely depends on where, how much product, what area.
Where, very important. Like places that you use a lot versus other places you don't, that are not constantly moving, may last longer if it's not moving all the time.
Perfect. Okay. I've got another question for you. Bruising or swelling. I know you talked a little bit about needle pokes and everything. Can you tell us a little bit more about expected bruising or swelling?
Usually not much. Okay, so a lot of I don't know how many HAs are out there. Let's say there's 12 out there. Some of them are more hydrophilic than others, which cause more swelling than others. I tend not to use those as much, okay? So I find the swelling's not that much. I find it goes down maybe 10 or 15%. The bruising, especially if you're on an anticoagulant or whatever, or if you've been taking aspirin or Advil, you're more likely to bruise. I do feel that there's more bruising down here. Sometimes you can bruise and sometimes you won't have any bruising. And I have actually taken pictures of myself with bruising from, I used to drive, my parents live in Baton Rouge. I would get injected by a friend of mine there. She's a great injector. She's a very popular cosmetic dermatologist in Baton Rouge. But I want to show patients, look, these are my bruises, from a very good doctor. So you have to you don't want to do this 5 days before an important event at your house or a fundraiser. You don't want to do it then, or before your daughter gets married. You want to do it like a month before, Okay.
Definitely great answer. I think that's a very common question and that's fantastic. Well, I think that we have gotten through everything today and I really appreciate both of your time. I have one more quick question and then we are going to sign off and I will follow up with you guys. Dr. Meyer, has the study showed different outcomes for men versus women?
Not that I know of. However, men can have deeper folds. It all depends on how deep your folds are and everything. Like for toxin, for example, men notoriously take more toxin, you know. And so with now men, I don't have a whole lot of men that want their lips done. For the men that I'm mostly doing are building up this area as they age. So it should last the same amount of time. They just may take more depending on their age. And as you know, there was
Perfect.
pictures of some men in here, right? There were some younger.
There were, and they looked fantastic too. It's nice to be able to see that you would expect if someone said I am a man and I got filler that it would be like someone walking out with the huge lips and whatnot, but those are very subtle and just kind of make you look more relaxed and more refreshed. So that was fantastic. I'm sorry, one more question and then we're done. Can you get filler and Botox in the same visit?
Absolutely, we do it all the time.
Yeah, fantastic. Great way, one-stop shop. Fantastic. Well, thank you so much, Warren. I really appreciate your time. Dr. Meyer, we appreciate you so much for sharing your education, your intelligence about this subject, and giving your opinion. And we really appreciate the time that you took to be with us today.
Thank y'all for listening. Good luck on raffle.
Yeah, so excited. Thank you guys so much. We'll see you shortly.